Good afternoon, everybody. Welcome to today's showing, True Temperance International Family Health Show. We're glad that you're able to join us, and you will not be disappointed for making that decision. So we're looking forward to sharing some amazing truths with you. And make sure you get your pens and your papers close by so that you can make notes, or whatever other device that you have that you can use for making notes. Please have them ready, because, well, I'm not going to say there'll be steam coming off your keyboards or whatever, but there's going to be a lot of information. Just to welcome those of you who are on YouTube as well. We have viewers on YouTube and on Zoom. So we're so happy to have you all with us. For those of you who it's your first time on True Temperance International, and if you're wondering what TTI stands for, that's it, True Temperance International. Okay, if it's your first time, we're a group of friends. We're more like family, to be honest, and we've been going on this platform for almost a year now with health talks every Saturday afternoon. Well, it's afternoon for us, but obviously it's international, so it could be morning for other parts of the world. And we have various topics. Now, we do have Telegram groups to keep in touch with people. So there are groups for men, women, and the spiritual health groups. So I'm not sure if you are ready to put a slideshow up at the moment that will show you the links, but we do have them in the chat, and they will be going on the YouTube chat as well. So watch out for that. We also have a website, truetemperanceinternational.com, and on there's links to a donation site. If you wish to bless us with a donation, we are more than happy to receive what you have to share, what you're inspired to share with us. Currently, we're working to improve the website. Yeah. Sorry about that. Currently, yeah, we're looking to improve our website, and so there's a various number of projects that the finances will be going towards. And every week we set a challenge. The challenge that we set last week was to learn about some herbs that you may find in the field, in your garden, as you go walking in the parks. And we chose 4 herbs: burdock, nettle, dandelion, and cleavers. And we were asking you to go out, look and see where you can find them, take pictures, and write some information about the benefits of them. And we're not going to go into your answers, although some of you have really shared really well on the groups, and I really appreciate that. That's just like, we know you're learning and you're sharing that learning. And we probably will be setting another challenge today, but if there's time at the end, you can share that, but we will do a gallery of your answers at some point, maybe in the next few weeks. So before I go any further, we have a disclaimer. So I'm going to ask if my husband can share the disclaimer on the screen, and I will attempt to read off that. Okay, we're just waiting for that to be ready. Right, so whilst we're waiting then, I'm just going to do a quick introduction of Brother Mayman Wilson, who is our presenter today, and the topic is cancer of the 2 brains. We're looking at bowel cancer and brain cancer. So Brother Mayman and his late wife, Dorinda Wilson, they established the Centurion Bible School of Health to provide medical missionary training and mental, physical, and spiritual therapies. They're based in Tennessee in the USA, and we will also be sharing contact details of the Centurion Bible School of Health. Okay, so that will appear in the various chats as well. So I think we're ready to screen share our disclaimer. Here we go. Right, so only a physician can diagnose, treat, and prescribe for illnesses or disease. Any information disclosed or discussed at the TTI Zoom talk show, they're for educational and information purposes only. Please continue to seek professional medical advice from your general practitioner regarding any illness or disease that you may be suffering from. Thank you, Edgar. Thank you. And so, as I said, we will be sharing information on the various Telegram groups that you can stay in contact with us on, and the donation information, although you can go via our website, which is under construction, but it's good enough. You can come in and see what we have for you for now. So are we ready over at Centurion Bible School of Health to welcome Brother Mayman onto the platform?
Yes, we're ready.
Okay, so thank you so much for joining us. We're excited to hear what you're going to share with us, and I'm sure this information is going to be very timely for many people that are tuning in. So once again, Brother Mayman Wilson, over to you.
I want to thank everyone for blessing me with an opportunity to just talk about something that I love and something that is my life. It's not a part of my life, it is my life. I've committed myself to be a part of this and to be a part of the finishing work, especially using the right hand of the gospel to open a door by which the gospel may be able to reach many souls. And it's a grand opportunity to be able to do this. I give you my personal disclaimer. I'm not a doctor. I'm not a physician. I'm a gospel medical missionary. And I truly believe a missionary is the greatest calling a man could have. It is not a step down in knowledge, but God has exalted his people to the highest image or the highest platform of knowledge because his spirit dwells with them. And if we have the Holy Spirit, he would impute his wisdom and his knowledge to us. When the world is running to and fro to gain insight and wisdom on what to do, God has already revealed it in his word. All he needs is his people to trust in his leading. Now may God bless us and keep us as we enter into this difficult yet appreciable study, cancer, as it pertains to our stomach, as it pertains to our bowels. God is so gracious and so merciful to allow us to be a part of this. We're going to be looking at different types of brain problems and some of the things we can do about this, and how difficult it is to really work with brain cancer because of the brain barrier. I have a brief word of prayer and then I'll get started. Father, once again, thank you so much for your grace and mercy. Be with us, Lord, through this session and guide us step by step. Give us your wisdom, your strength, in Jesus' name, amen. So, appetite, the fall of man. And that is the fall of man, but it can also be redemption of man because we have eaten ourselves to death, Sister Tess. And I truly believe that Sister Tess is here to help me, to help co-host this program. And I truly believe that even though we have eaten ourselves to death, I believe we have the grandest opportunity to eat ourselves into good health.
Absolutely. I do believe that it can be reversed. And that's the reason Jesus came, to restore us back to Eden.
Amen. And we're in that restoration period when we can be restored back.
Creator of man has arranged the living machinery of our bodies. Every function is wonderfully and wisely made, and God has pledged himself to keep this human machinery in helpful action if the human agent will obey his laws and cooperate with God. Every law governing the human machinery is to be considered just as truly as divine in origin.
God has pledged himself, his promise, and these precious promises can be banked on and draw dividends.
Amen.
We didn't have anything to put in the bank. God put it all there. So God has pledged himself to keep the human machinery in healthful action. He's there helping us to get through all the trials and tribulation, the malfunction of the organs. He's there to help us to regain a balance back into the system. If we truly believe this, if we truly believe that we was created in his image, a divine object of him, a reflection of him, then we can believe that God can sojourn in us.
Amen. And I think the key here is God is always faithful. He's always faithful. He's wanting. I wish above all things that you be in health. But it's conditional. It's up to us to obey, because any violation of God's law is what is going to bring the disease.
Amen.
So God is always going to do his part, but we have a part to play as well. In character
And importance.
and important as the word of God, every careless, inattentive action, any abuse put upon the Lord's wonderful mechanism by disregarding his specified laws in the human habitation is a violation of God's law. We may behold and admire the work of God in the natural world, but the human habitation is the most wonderful ministry,
Medical ministry.
medical missionary 221.
You know, every slip, every little indiscretion of saying that I eat a little of this and a little of that, it won't hurt very much. But I read that even eating just a little moisture between meals is a violation of the natural laws. So these things are real important. As we really consider the marvel of the world, we consider that the Grand Canyon and the beautiful oceans and the big mountains and how beautiful they are in nature. But the greatest creation is the human habitation.
Wow, that's huge.
God has made the image of God. Just go down a little bit further, Tess, if you can't see that.
Okay, this fact, man is very dear to God. That's huge because he was formed in his own image. This fact should impress us with the importance of teaching by precept and example the sin of defiling by the indulgence of appetite or by any other sinful practice, the body which is designed to represent God to the world. And God blessed them, and God said unto them, be fruitful, multiply, and replenish the earth, and subdue it, and have dominion over the fish of the sea, and over the fowl of the air, and over every living thing that moveth upon the earth.
You see, God wanted us to be co-laborers with him in the creation process. The act of procreation is the act to recreate. And the procreation process is not finished. You bring forth a living thing by the divine miracles of God, when man and woman come together. But the finalization of the creation process is the development of character after the similitude of God. And that is the purpose by which God put in mothers and daddies to finish that creation, that restoration process.
Amen. And God said, behold, I have given you every herb bearing seed, which is upon the face of all the earth, and every tree in the which is the fruit of a tree yielding seed. To you it shall be for food.
And not flesh.
That's right.
But the way God look at food is meat. And that's really the proper understanding of it. In the very beginning, God gave man his diet. It was a perfect diet for a perfect man. And this diet was not seedless. Every food that would grow had to bear a seed. It was the design purpose of the enemy to amalgamate the food to make them seedless, knowing that we are so gullible to think how inconvenient it is to chew and spit out seeds, he removed them to satisfy our comfort at the expense of ill health. So remember that every time we partake of food that do not have seeds, we're eating empty calories, foods that do not have enough substance to replenish and to restore our bodies, because it can't even grow its own plant. And so don't fall into this deception. Know that if you're constantly eating seedless food, you're eating food without any substance.
So there's something to be said for the seed in the foods. Is that what you're saying? Is depleting the nutrients from the food?
You know, it's kind of like you cannot produce a child without a sperm or an egg. It will not replicate. If that mother cannot produce a healthy egg, then it cannot develop a child. And so the egg will just dissipate and die at the end of its term. What's the same thing with food? If the food do not have a seed, it cannot replicate, it cannot grow, it cannot produce. And God has given these foods that we may replicate, that we could grow. And so we will not grow. We will simply become stagnated.
Built by the food we eat. Our bodies are built up from the food in which we eat. There is a constant breaking down of the tissues of the body. Every movement of every organ involves waste, and this waste is repaired from our foods.
Okay, so now let's look at that, because she said that all the food that we eat is broken down. Carbohydrates are broken down to glucose. So that means that our protein is broken down to amino acids, and our fat is broken down to fatty acids. What is the purpose? The design purpose of God is for these elements to replenish a body. And so consequently, if you eat too much protein and your body's not able to metabolize it, you're going to have a surplus amount of free radicals, undigested protein in the system. Your body will seek a way to try to remove that protein. Many times it will warehouse it in your body, in the crooks and crannies of your body, between the joints and muscles. This brings about irritation, which bring about inflammation, which we get the term called arthritis. Diabetes is the same way. If your body is consuming a lot of carbohydrates, simple carbohydrates, too much starch, then your body will not be able to handle that. So once again, all this surplus amount of sugar made from the glucose is going to remain in your bloodstream. It's going to bring about malfunction of your pancreas. Your cells will not be able to metabolize this sugar. Now you got a high blood sugar level. And it's the same thing about fat. Too much fat is going to build up in your arteries and cause all type of plaque and build up in the arteries.
America's #1 killer.
And so we can see that food is important to break down, but the food must be properly digested and eliminated.
And so moderation is the key here as well.
It is.
Everything in balance. Each organ of the body requires its share of nutrition.
And that's important because our central nervous system needs to B vitamins. Our cells need the glucose. And the protein is needed so that the cells can rebuild the cellular wall. So everything have a design purpose. And when there's a deficiency, there will be decay and death.
The brain must be supplied with its portion. The bones, the muscles, and the nerves demand theirs.
I can tell you right now, the brain is number one on the menu chart. When we eat, nourishment must first satisfy the brain. Oxygen must first satisfy the brain. If you have poor circulation, and your brain will be the first one to be deprived of it. The same with energy. And if there's not a proper amount of nourishment going to the brain will suffer for that.
It is a wonderful process that transforms the food into blood and uses this blood to build up the varied parts of the body. But this process is going on continually, supplying with life and strength each nerve, muscle, and tissue.
We are what we eat.
We are what we eat, absolutely. The second brain, the stomach. In eating, true temperance teaches us to dispense entirely with everything hurtful and to use judiciously that which is healthful.
And since that stomach is the first organ to receive the nourishment, we can confuse the stomach in many ways by simply overcrowding the stomach, overburdening the stomach. Too many complicated combinations of food. The stomach is designed to break down protein and help in the aid of breaking protein down to amino acids. Well, if your stomach is handling more simple carbohydrates and more fats, it's going to confuse the stomach. And so you must be able to know food combining in order that you won't overburden your stomach.
So the simpler the diet, the better.
Well, it's free from all the denatured, devitamized, demineralized, and not so saturated with so much fat and protein.
There are a few who realize, as they should, how much their habits of diet have to do with their health, their characters, their usefulness in this world, and their eternal destiny. The appetite should ever be in subjection to the moral and intellectual powers. The body should be servant to the mind and not the mind to the body.
It's truly been said that God did not give appetite to man. God gave appetite to the beasts, to the animals. Appetite is an unnatural craving for a particular type of food. In other words, you can eat all the callaloo, turnip greens, kale you want to eat. But if there is a desire after satisfying yourself for apple pie, that is appetite. Hunger is what God gave us. Hunger is the knowledge to know that you need to replenish yourself and not to overindulge yourself. Sad to say, we are feasting on pleasing our perverted appetite.
So we need conversion in the way of appetite. Is
Amen.
that correct?
That's right.
Those who eat and work intemperately and irrationally talk and act irrationally. Wow, one does affect the other.
It's going to affect, because see, if you're not getting the proper nutrients, your central nervous system is going to be out of balance. If you're not getting those B vitamins from your nuts and seeds and whole grain, then your central nervous system is going to feel affected. You're going to be nervous, irritable, easy to get excited, depressed, stressed, because your body is not being replenished.
It is not necessary to drink alcoholic liquors in order to be intemperate. The sin of intemperate eating too frequently, too much, and of rich, unwholesome foods destroys the healthy action of the digestive organs. It affects the brain and it perverts our judgment. It prevents rational, calm, healthy thinking and acting.
Yeah, I mean, actually, there are more alcoholics that never drank any alcohol. We are really are drunk on the food we eat, because all food is converted to substance in the system. Alcohol is made from sugar and corn through a fermentation process. Well, if your poor digestion, if your bodies have poor digestion and you're consuming a lot of starches and sweets, and your liver's malfunctioning, you can make alcohol yourself. And so distill it in the system and still be of the same effect as it would be if you were drinking alcohol.
So that's why we have more of non-alcoholic cirrhosis of the liver.
Right, and other problems like that too. That's when people think irrational, people impatient. When a drunk man cannot drive a car in a normal way, so he do things very dangerously. And it's the same way when you eat.
Special care not to overeat. In 9 cases out of 10, there is more danger of eating too much than too little.
But people don't view it like that. No. They don't. People eat to feel full. And most of the time they're overdoing it.
So the key is not to feel full. You should stop right before you feel that fullness. I read that in Counsel on Diet and Food, that we should sit down to eat and get up with the same feeling we sat down with. But if you're going to eat and feel stuffed and sleepy, you have just sinned. There are many sick who suffer from no disease. The cause of their sickness is indulgence of appetite.
Yeah, and that's so true. You know, that's people say, well, you know, don't hurt me. I can eat whatever I want to eat. Right. But they don't realize they're just as sinful as a person that overindulge.
They think that if the food is healthy, they may eat as much as they please. This is a great mistake.
Don't we see that in potluck?
Yes.
We do. It's a disgrace. I mean, this is the time when we let all governors go. We said, I can eat as much as I want to eat and please myself because I'm in the church and the church has agreed and made it possible for me to overindulge. We actually violate more days of worship, feasting, than we do the rest of them.
Wow, that's incredible. And there's a scripture, I can't remember the exact reference, that says something to the effect that if you don't have temperance or discipline and you're before a meal like that, then you should.
Yeah,
right.
That's so true.
Persons whose powers are deliberated should eat a moderate and even limited amount of food.
Especially if you've got some issues. And I'm telling you something, we all got issues. Let's face it. There ain't no perfect man up in here. And even Christ was the only perfect man, and he had good temperance.
Right.
So he set a pattern for us. We must cut back on the amount of food we are consuming.
The system will then be enabled to do its work easily and well, and a great deal of suffering will be saved. The inhabitants of the antediluvian world were intemperate in eating and drinking. They would have flesh meats, although God had at that time given man no permission to eat animal food.
Now, did they consult God on what they should eat?
Absolutely not.
It was already there, fruits, grains, and nuts. And then vegetables is what God gave you to eat. They didn't talk to God, they talked to their perverted appetites.
They ate and drank till the indulgence of their depraved appetite knew no bounds, and they became so corrupt that God could bear with them no longer. Their cup of iniquity was full, and he cleansed the earth of its moral pollution.
Why did this happen? Why did they come to that mental state? Is because they robbed their system of the essential nutrients they need to make right decisions. They was depleted in B vitamins, their nerves was deprived, and so consequently, they made bad decisions.
So this tells me that diet, appetite, has a lot to do with our salvation.
No doubt.
Yeah.
It is. It was the foundation of our fall. And believe me, it would also play a great part in our recovery.
Disease never comes without a cause. Glioblastomas, also called GBM, are malignant grade 4 tumors where a large portion of tumor cells are reproducing and dividing at any given time.
This glioblastoma is one of the most difficult brain cancers in the world to deal with.
Why is that?
It's just one. Well, man can't cure no disease. I'll just be honest with you. There's, and now I know people challenge me on that when I said there is no cure for disease by man. If you go to a drugstore and you look at all the pharmaceutical products, not one of them products will say it can cure. It said it would aid, it would relieve, it would help. That is a deception of the devil. That's the way the devil deceives you. You think help you don't mean cure you. Help you do what? Help you be at ease. Help you be free of pain. That's what he's really saying. Help to remove the symptoms. But symptoms is not the problem. Symptoms are the solution. Symptom is telling you something is wrong. That is the voice of God speaking to you, letting you know you need to do something, make some changes.
Right. It's letting you know that you're violating some laws of health.
That's right. So, but it is difficult because it can invade the whole body of the brain. And what makes it even so difficult is that the brain have a barrier that prevent anything from intruding except something that would be an aid to the brain.
They are nourished by an ample and abnormal tumor vessel blood supply.
And what it is, the brain have just a spider web of brains of vessels, blood vessels running all the way through it. Hundreds of thousands of blood vessels. This is what makes it so difficult to treat, is because those blood vessels, just one of those blood vessels inwoven in the inner of that brain could be infected. And it's very difficult for them to find it and to deal with it. You have two barriers. You have this spider web of vessels, and then you have that brain barrier that will not let nothing come across except something that would be an aid to the brain.
The tumor is predominantly made up of abnormal astrocytic cells, but also contain a mix of different cell types, including blood vessels and areas of dead cells, necrosis.
So you got this mix. You got this mix of angiogenesis cells and healthy cells and also necrosis cells. It's a mix in a spider web. The angiogenesis is the growth of abnormal blood vessels that the body needs, whether the cancer cells need to be able to replenish oxygen nourishment to feed the cancer. Necrosis is where this tissue reaches a certain cycle and it dies, leaving debris there. And then we have the healthy cells there. They're all mixed together. And this makes it so difficult to deal with this problem.
So it grows and it spreads.
It spreads, yes, it does. Here we can also see that looking at different portions of the brain, how this blood circulates. It circulates to all portions of the brain. Your white blood cells would love to come in and help, but they're limited. They're limited because the brain barrier do not permit them to come across the brain barrier anytime they want. The only time the white blood cells can cross the brain barrier is when there's an infection in the brain. And occasionally it will let it come through.
So it won't detect a tumor as an infection?
Well, the white blood cells recognize there's something in the brain ain't right. They want to cross the brain barrier to go ahead and kill it. But the white blood cells is identified as something that should not intrude the brain barrier unless the brain permitted to come through. Now, it will at times let it come through, but that's not a regular basis. It's difficult. And that's what makes it so hard. Anywhere else in the body, your lungs, your stomach, the white blood cells can just run straight through. But when it comes to the brain, you say, hold up a minute. We need to check to see, can we let you go through? And it is difficult. The brain is the most difficult organ in the world to deal with.
Brain tumors are among the most densely vascularized tumors. This increases the possibility for the tumor cells to take advantage from the frequent brain perivascular niches.
It is, because all those blood vessels are there, and it can be taken advantage of because it's a favorable medium for something to grow. If an impurity, infection, chemical can get across the brain barrier, it's going to have a fertile field for growth.
The understanding of the cellular crosstalk established within the brain tumor perivascular niche might provide us with key discoveries of new brain tumors vulnerabilities. The blood-brain barrier, resistance mechanisms in brain tumors. Brain tumors are intrinsically resistant to therapy.
Okay, now what it means is that therapists, in particular drug therapists, have a very almost impossible chance to come in and treat a brain condition.
Is that because of the brain barrier?
That's because of the brain barrier.
Okay.
It recognizes it not a part of self and not a part of anything can benefit the brain.
Radio or chemotherapy, and the reoccurrence rate is very high.
It is very high, the reoccurrence, because chemo can do nothing to many brain cancers. And if radiation, there's so much collateral damage that sometimes it don't even make it worthwhile.
Resistance mechanisms in brain tumors. Brain tumors are intrinsically resistant to therapy, radio or chemotherapy, and the recurrence rate is high. Chemoradiation resistance is one of the most clinically relevant challenges faced in patients with brain tumors.
Okay, now you go to the good physician, he tell you, we're going to use chemotherapy to treat your brain tumor. He already knows that it's resistant, that the brain resists the penetration of chemotoxic drugs. He knows that, but he has no other recourse, none other. He don't know nothing else to do. He's just hoping that somehow it will help. But he knows medically that the brain resists the penetration of cytotoxic drugs called chemotherapy.
So what about surgery?
Well, yeah, surgery is...
Can you just take the tumor out, or is it difficult?
The most difficult thing about that is you can't cut cancer out. You can cut out the large mass, but cancer has so many little particles and roots to it, they can't cut it out. And so they would have to cut out most of the brain. So yes, that's probably the most practical way to do it from a medical perspective. But you remember that God has a better program. The life of the flesh is in the blood. If we treat the blood, we'll treat the problem. But medical systems seem to go to try to bring in some type of stimulant that will address the problem. It will never do it. Instead of using what God's method, treat the blood.
Treat the blood.
And the treating the blood is that organs and tissues, they go through a cycle. They have a life cycle. They die and it's replaced and replenished. And so the only way they can die and be replenished healthy is to have healthy blood.
That makes sense. They can also sometimes spread to the opposite side of the brain through connection fibers. It is exceedingly rare for glioblastomas to spread outside of the brain.
That's a good thing.
It is.
Because see, it's the same thing with that barrier. It won't let it go out and it won't let it come in.
That's a good thing.
So that it retains what's in that brain, even though it could be to the death and destruction of the brain.
Glioblastomas may arise de novo, meaning they begin as a grade 4 tumor with no evidence of a lower grade precursor.
That means that when you find out, you're already in trouble. You know, it don't give you that pre-warning, like stage 1, stage 2. By the time you find it out, it is already stage 4.
So there are no symptoms that...
Well, they are, and we're going to look at some, but they are everyday symptoms that you could experience, you know, and you may, a slight headache, dizziness, nausea, you may not think that to be very much. Right.
De novo tumors are the most common form of glioblastoma and tend to be more aggressive and tend to affect older patients. Alternatively, secondary glioblastomas may progress from a lower grade astrocystic tumors and evolve into grade 4 tumors over time. In general, these tumors tend to be slower growing initially, but can progressively become aggressive.
And one thing about it, I've worked with a lot of brain cancer, a lot, especially in the last 15 years. More and more, I'm working with brain tumors. In the beginning, the first 20 years or so, I worked more with prostate and breast cancer. But I'm seeing a trend where more and more brain cancer. And the one thing I have found that most of the time it's a slow developing process, which is good because the great threat with brain cancer is pressure. So the brain swell. If the brain swell, increase pressure. Well, the brain is encapsulated in the skull. So any swelling can really cause problems. Most people I've seen that die of brain cancer die from the brain swelling and inflammation of the brain.
That sounds very painful. Glioblastomas are generally found in the cerebral hemispheres of the brain, but can be found anywhere in the brain. IDH mutant glioblastomas tend to arise preferentially in the frontal lobe. Symptoms: patients with glioblastomas develop symptoms rapidly due to mass effect from the tumor itself or from the fluid surrounding the tumor, edema, that causes the further brain swelling.
And we need to look at, I'm hoping we can get to it before my time run out, how we can reduce the swelling, because that is going to prolong that person's life and give them the best chance of survival.
For example, common symptoms at diagnosis are related to the increased pressure in the brain, nausea, vomiting, and severe headaches, which are typically worse in the morning.
Yes, and people sometimes just put this off as, you know, something.
A headache, I didn't sleep well or something. Patients can also present with neurological symptoms, which are dependent on the tumor location. For example, weakness or sensory changes of the face, arm or leg, balance difficulties, and neurocognitive memory issues.
One big thing is seizures. Seizures is usually when they start having seizures, the pressure is elevated. So let's take a look at that and let's see what we can do about that.
By the time she was 2, though, the seizures had become constant and started to take their toll on their once happy, joyful little girl.
She started to really decline cognitively, and she was slipping away, and she just wasn't keeping up with her twin.
The Figgies finally found an answer. It was awful news. Dravet syndrome. It is severe, intractable epilepsy. The seizures start during the first year of life and are unstoppable, difficult to control, and very damaging. For the next 2 years, the Figgies tried everything. Strange diets, acupuncture, and dozens of powerful drugs like Valium, Ativan, phenobarbital. But nothing seemed to help. Even worse, some of the medications nearly killed her.
After 1 dose, she stops breathing, and after 2 doses, her heart will stop.
Did you have to do CPR then on her yourself?
Yes. I remember when her heart stopped and I had her pulse, and I lost her pulse. There was just nothing. The ambulance is on its way.
She survived.
Mommy's here.
But now it was fall of 2011, and Charlotte was 5 years old.
When things were at their worst, she just sees all night, and the kids are sleeping either in my room or next door. They can hear her, the seizure scream all night, 50 times a night. And Chase would come in the morning and just, this is her twin, and just hug her and like rub her head and say, I'm just so glad you survived through the night last night.
Matt had been deployed to Afghanistan, and the only thing he could do to help was start scouring the internet. And he stumbled onto this video of a child using marijuana.
So how's everything going? Jaden had 4 days without a seizure.
I'm like, wow, having success on specifically Dravet, this is interesting. It's natural.
And while he couldn't ever imagine taking marijuana himself, he was now in the stunning position of recommending it for Charlotte.
I was like, we need to do this.
And I said, I don't know.
Charlie, there you are.
And then Charlotte's condition got worse. 300 seizures a week, almost 2 every hour. She was not talking or moving, basically catatonic. As a last resort, doctors wanted to either prescribe a powerful veterinary drug used on epileptic dogs or put Charlotte in a medically induced coma so her brain and body could rest. For Paige, those were not good options. But maybe, just maybe, marijuana now was. Here's how scientists think it might work. Marijuana is made up of 2 ingredients. THC, that's the psychoactive part that makes you high, and CBD, also called cannabidiol. It's the CBD that scientists think modulates electrical and chemical activity to help quiet the excessive activity in the brain that causes seizures. Behind closed doors and under tight security, we enter what the Stanleys call the Garden of Eden.
There's nothing like this in the world. This plant's 21% CBD and less than 1% THC.
It took years of crossbreeding plants to get to this point.
Instead of breeding up the THC, we've bred down the THC and bred up the CBD. And people said, you're crazy. You know, who's going to smoke that?
So why grow it then? Well, the Stanleys also believed in CBD's potential to treat many diseases. It was January 2012, Afghanistan. About 7,000 miles away from his family in Colorado, Matt Figgy received this video from his wife, Paige.
It's horrible seeing these videos when I'm deployed.
It was his 5-year-old daughter, Charlotte, seizing. Diagnosed with a severe form of epilepsy, she was having 300 seizures a week. Each attack so severe, it had the potential to kill her. They had already tried dozens of high-powered drugs.
We needed to try something else, and at that point in time, marijuana was that natural course of action to try.
At home in Colorado, Paige searched for marijuana high in CBD. That's the ingredient some scientists think helps seizures, and also low in THC. Remember, she didn't want to get her daughter stoned. She found a small amount at a Denver dispensary. The owner was surprised that anyone would want it.
They said, it's funny because no one buys this, you know. That was the general consensus, that nobody wanted it. It didn't have any effect.
Paige paid $800 for a small bag and took it home.
I had a friend that was starting a business on making medicine. And I said, can you help me extract the medicine from this bag of marijuana? I measured it with a syringe and squirted it under her tongue. It was exciting and very nerve-wracking.
Holding Charlotte in her arms, Paige waited. An hour ticked by, and then another, and then another.
She didn't have a seizure that day. And then she didn't have a seizure that night.
Did you sit there and look at your watch? And...
Right, I thought, this is crazy. And then she didn't have one the next day. And then the next day. And I thought, she would have had 100 by now. And I just
now, when
thought.
you listen to this, you automatically, the red flags go up, marijuana, and it goes up with me too. I would never give a narcotic to a patient. But in the case of this type of marijuana, they have grown out the THC. Mm-hmm. The THC is the narcotic. The CBD is the medicine. And so what they did, they crossbreeded it and growed out the THC by mixing the marijuana with a healthy plant. And eventually, by doing that over a period of years, they slowly grew away the THC, the narcotic, and increased the CBD, the medicine part of it. That's clever. It was very clever. It worked. But basically, that's what the science of that is. If you want to make a peach real sweet, you simply amalgamate it with a little mango or with something else sweet, and you grow them together, and it'll take on extra sweetness. They do food like that all the time. So it wasn't a new invention. It was a very clever invention to do it with herbs, and he did it with herbs, and it worked. It took out the good, dominated, and forced out the bad. And I almost kind of believe that's what's happening to us in our Christian experience. It works, and I've used it a lot, and it will not get you high, but it will help tremendous. We're going to go through this briefly, just looking at different types of conditions that is associated with different types of brain cancer.
Arteriovenous malformation.
This is where some of the arteries and veins are malfunctioning. And a lot of times that can come from birth, a birth defect, or something can cause them to malfunction.
These are defects of the brain circulatory system that are generally believed to arise during embryonic or fetal development.
And it's during that development stages, you got hundreds of thousands of arteries and veins. Something can go wrong. It's kind of like a computer. You're computerized, and it's got what you call a spell check.
Right.
And if it missed just one of the hundreds of millions of things that it's calculating, it can throw the system off. And that's what they perceive may have taken place.
Normally, oxygenated blood is pumped by the heart through branching tubes called arteries to the brain, where it enters a fine network of tiny vessels called capillaries.
So you got all this nice oxygen flowing through from the heart, all to the arteries, then it goes to the brain, then it goes to the capillaries. Each time they get smaller and smaller and smaller. So you got all this great force coming through, but then that force is broken down to tiny little arteries and capillaries, but it's so many of them. And so it kind of dissipates some of the pressure under normal circumstance.
It is in these capillary beds where the blood nourishes the tissues. The deoxygenated blood then passes back to the heart through branching thin-walled tubes called veins. That's why we need to keep our veins clean, right?
Yeah.
The arteries bring oxygenated blood and nutrients and divide into small vessels called capillaries. The nutrients and oxygen leave the blood and enter the brain tissue from the capillaries. Waste products enter the capillaries from the brain tissue, and the blood is then drained from the capillaries into veins, which carry the blood back to the heart and lungs. Red vessels, arteries have oxygenated blood, and blue vessels, veins have waste products. The arteries have high pressure as the blood is pumped directly into arteries by the powerful beating heart muscle.
So the arteries can handle that high pressure. It can do it. But that pressure gonna have to drop some for those little tiny capillaries and the veins.
The veins have low pressure due to the fact that the arteries divide into hundreds of capillaries that dissipate the pressure.
So you can see you got so many the veins and capillaries that the pressure is just dispersed. So it won't burst those little capillaries and veins
And
in the lung.
an analogy would be similar to a fast-flowing river, similar to an artery flowing into a very large lake, similar to capillaries. That makes sense.
Yeah, it makes a lot of sense because you got a big ocean and that water is running out the ocean. Then the pressure will, we got a lot of little streams to run into, then it's going to slow that pressure down.
Although the river is flowing fast and furious, the very large lake is still and calm. So the capillaries dissipate the pressure, the veins have low pressure. This drop in pressure occurs along all arterial venous connections. Arteries have thick walls to handle the very high pressure, and the veins have thin walls as they only have to withstand low pressure.
So now if that pressure increase in those veins, then it could cause it to burst.
Right. AVMs are essentially faulty connections between arteries and veins. In an AVM, the capillaries are missing. Instead of the capillaries, much larger sized blood vessels connect the artery directly to the vein. The veins are, as stated above, are thin walled, and the high arterial pressure can rupture the veins, resulting in bleeding in the brain called a hemorrhagic
And that's
stroke.
how it developed.
So the pressure is too much for the tiny little veins.
Because
so
the walls
ruptures.
are thin, real thin.
Okay. Is that the same as an aneurysm?
It is. It's basically the same.
Okay.
Mm-hmm.
About 0.14% of the US population has AVMs. Given a population now of about 318 million in the United States, that makes up 444,000 people in the county with AVM.
And it's a lot of it because of cardiovascular problem, high blood pressure. High blood pressure can cause an increase in that pressure and can cause those capillaries to burst. I'm gonna speed up time's sake.
This is a significant risk, particularly that each bleed has a 1 in 10 chance of causing death. And if you survive the bleed, there is a more than 50% chance of causing disability. For these reasons, aggressive treatment of AVMs is undertaken to eliminate these risks.
You better be quick too, because it don't play. It's like an aneurysm, artery burst. It's too much pressure. You got to reduce that pressure.
And this can occur anywhere in the body, correct?
It basically could, but main is your head and your cardiovascular system. Let's take for instance, if you know that you got too much pressure in your head area, a brain area, and not enough pressure in your lower extremities. So what you need, and now you got really large arteries down in your hand and in your lower extremities, large arteries, which can handle that pressure. But up here, you got those tiny little capillaries up here in your brain. They can't handle it. So what we need to do is redistribute that pressure from the brain to the what? Lower extremities. So what you want to do is apply a cold compress to the head and a hot foot bath to the lower extremities. Give them some herbs that will increase circulation, like ginger, cayenne, hawthorn berries. That would increase the circulation, move the stagnation from the head, send it to the lower extremities. That can buy you some time because otherwise your time is finished.
Typically, if an AVM amenable to surgery, then this is the preferred method. Once the AVM is removed surgically, it immediately removes the risk of rupture and bleeding. For AVMs that are not treatable by surgery, radiation is usually the method of choice.
So when you have this artery vein malfunction, if it's treatable by surgery, that's a good move.
Right.
But not all of them are like that. It's not that simple. You'll see.
The disadvantage of radiation is that it takes time for the radiation to damage the AVM nidus and cause it to shrink and scar down. This process typically takes 2 to 3 years.
That may be too long.
That's a long time.
And you already threatened aneurysm, artery bursting. It's too long, and they know that.
So radiation procedure of the AVM over several years, and during this waiting period, the patient is still at risk for bleeding. In addition, radiation only works best with small AVMs and does not work as well as large AVMs.
So you can see now radiation is not going to get it. I mean, unless it's very small, large, it don't work at all.
This is an angiogram-based procedure and not a surgical procedure. It is referred to as a minimally invasive procedure, as unlike surgery, no cutting in the head or skull or manipulation of the brain is involved. Embolization procedure is performed by introducing a small catheter through the artery in the groin area and carefully navigating the catheter into the brain arteries. Once in the brain arteries, then the tip of the catheter is carefully placed into the individual shunts of the AVM, and one by one, they are blocked by introduction of a blocking agent into these shunts.
So these are very sophisticated approaches to try to stop a severe thing like an aneurysm or vein bursting open. And a lot of it is from this angiogenesis.
Anti-angiogenesis. A cancer cell develops, but it must clear out space and get a blood supply to grow larger.
So we see the cancer growing now.
The cancer cells begin to divide.
And the more they grow, the more oxygen and blood they're going to need.
The cancer reaches a size 50.
And once it reaches a certain size, it's going to start sending out chemicals to cause it to get more vessels, blood vessels to grow to feed the cancer.
That's the angiogenesis process.
It is.
50 to 100 cells where it needs nutrients to continue its growth. The cancer cells release angiogenesis.
So it's releasing a chemical now, angiogenesis factor, to stimulate blood vessels to grow. You can see the blood vessels growing. It's going to connect to the tumors.
Angiogenesis begins so the cancer can receive nutrients from the blood supply and cause metastasis.
Now the cancer can grow and metastasize.
The formulation includes anti-angiogenesis.
And that's how angiogenesis works. That's an abnormal process. What we want to do is to prevent this by starving the cancer to death.
Eating to starve cancer could have a dramatic impact on cancer rates across the world. Resveratrol from red grapes, for example, have been shown to inhibit abnormal angiogenesis by 60%. That's amazing. Even more potent is the ellagic acid found in strawberries.
Yeah, you know, one of the best treatments in the world to stop angiogenesis, the growth of abnormal blood vessels, which is the primary reason why cancer metastasizes, is through fruit and berries. Resveratrol in grapes is fantastic. One of the oldest method of dealing with cancer is called a grape cure. And it's so sad that people are now that should know the truth are advocating don't eat sweet fruit because it can cause cancer to grow.
Because of the sugar.
Because of sugar. And there's positive evidence that the grape cure was one of the most best treatments in the world to deal with cancer. Carrot juice was another one that's high in sugar, was one of the best treatments to fight cancer. But yet, these new age concepts is just the devil trying to amalgamate thoughts into people's head that has no concept that everything you eat is converted to sugar. That all the cells, good and bad, need sugar. Well, if the cells need sugar, then give them sugar, wholesome complex sugar that can help repair the system.
So are you recommending red wine as opposed to, or we're recommending just eating the red grapes?
No, the grapes. Once again, I would never, now unfermented red wine, yeah.
Right.
But no fermented wine because God has given us wine that move to the left and move to the right and sting like an adder, we are not to drink it. But grapes here is good. Also, strawberries has powerful anti-angiogenesis properties. Now we're going to look at some more angiogenesis properties, such as in green tea. We talked about strawberries, blackberries, raspberries, blueberries, cherries, garlic, tomatoes, some of the maitake mushrooms. You see, the future for medicine would be anti-angiogenesis. Surgery is becoming antiquated. It is. Chemo is not working. That has failed miserably. But they're investigating now angiogenesis. They want to see how to stop these cells from growing.
The abnormal cells.
They've been knowing about it because every time they do surgery, they cut through those vessels and arteries and they cut through it. They do not go back and sew them back together again. So once they cut them, they sew them back up, and guess what? They grow back and knit themselves back together.
So if we can stop the abnormal blood vessels from growing, then we would starve the cancer.
You would starve them to death because they wouldn't get the oxygen.
Right.
Even though cancer need a low oxygen, they have to have it to survive. They have to have nourishment to survive. You can deprive them of that by simply understanding the science of anti-angiogenesis. Very few people understand this science.
Logically, different foods contains different potencies of anti-angiogenic compounds. But interestingly, when researchers evaluated a combination of two of the least potent teas, for example, they discovered that this combination tea had greater potency than any given tea by itself. Now, what could that be?
Well, by mixing them, by
Mixing
combination,
the teas, okay.
a combination of them, by developing a formula. Even though they may be weak by themselves, they complement each other when you mix them in a formula. 2, 3, or 4 herbs together, they work together.
They complement each other.
That's right.
Okay, that makes sense. Some foods are as potent or more potent than anti-angiogenic drugs.
Yeah, they have a number of anti-angiogenesis drugs on the market now that supposed to dry up those abnormal cells where you don't need surgery, especially with brain cancer. But when they compared it with the anti-angiogenesis natural foods and berries and certain fruits and herbs, they found that many of them was many times stronger than the angiogenesis drugs and had no side effects.
Now there must be an intelligent designer, I keep going back to that, who designed the foods for the healing of the nations.
He did. He gave us for the medicine.
Amen. Examples of foods equaling or exceeding the potency of drugs include parsley, garlic, and again, red grapes.
And here we can see a combination of juices that really is a vegetable blood transfusion. Remember, the life of the flesh is in the blood. So you fix the blood, you fix the problem.
So what are the foods that we should eat to fight or starve cancer? The vast majority of our recommended foods are fruits and vegetables, including blueberries, strawberries, apples, oranges, peaches, onions, tomatoes, cauliflower, carrots, sweet potatoes, kale, broccoli, grapes, and spinach, grains and seeds, including brown rice, oats, whole grains, beans, legumes, including chickpeas and lentils. What a variety.
And you never can exhaust it. I mean, they all have their own design purpose. And if we would eat more of these foods in their natural state, then we would benefit. Here's a list of anti-angiogenesis foods right here. I won't go through all of them, but they're all here. If I had a cancer, then I would seek out God's pharmacists.
Amen.
Seeking what God has put in natural foods that have anti-angiogenesis properties. Understand that plants develop an immune resistance to pests, to fungus, to decay, to anything. It developed an immunity to it. And nature has a funny way of doing it. Sometimes, like in in blackberries, they grow thorns, so if you try to pick them, it's sticky.
Right.
They'll release a toxic protein that irritates your skin. I know one of them is persimmons. You eat persimmons, kind of greenish, it turns your mouth like it's twisting, But that is a natural immunity that plants develop to protect themselves. If we eat these foods, we will incorporate their natural immunity into our body.
Wow, that's powerful. Eating to defeat cancer can simply be done by adding a few cancer-fighting angio foods to your meals each day. Why not choose foods that can help reduce your risk of disease? We've listed more anti-angiogenic foods to help you get the most cancer-fighting benefits for your diet. So eat them.
Eat plenty of it. And here's some herbs that are wonderful, that works along with some of the angiogenesis foods, such as wormwood, sweet wormwood, very famous herb here that they use in the tropics. It is, and they used it in China when they was dealing with the situation over there with the virus. And today China is in a lot better shape than most of the world because they focus on the Chinese wormwood, and it just about wiped that virus out. And they are in better shape than all the other nations of the world.
So wormwood is an antiviral?
It is an antiviral. It's also anti-angiogenesis. It boosts the immune system. It's anti-parasitic. So it kills parasites. Also mistletoe. Mistletoe is a beautiful European mistletoe. It's also anti-angiogenesis. Curcumin, extract from turmeric. Chinese skullcap is really good. And we talked about resveratrol and the magnolia tree that we grow all around here are very high. God has caused food to grow in your area that can be used to fight disease. Here's a whole list of them. I'm not going to go through all of them, but we make a formula out of this. And we give this as a formula to boost your immune system and to resist the decay of disease.
Angiogenesis is the formation of new blood vessels. The process involves the growth of endothelial cells, which line the inside walls of blood vessels.
And we talked about that. It is the growth of new abnormal blood vessels.
In order for the tumor to grow.
Right.
Dr. Harold Varek, who received NFCR funding for over 30 years, discovered that tumor cells secrete a vascular endothelial growth factor. And this discovery provided the molecular basis for the field of angiogenesis.
So he discovered that, and then now we are just now tapping in on some of the resources that he found.
Angiogenesis, the recruitment of new blood vessels, is an essential component of tumor progression.
So it recruit, it go out and recruit the regrowth of blood vessels.
Malignant brain tumors are highly vascularized, and their growth is angiogenesis dependent.
Yeah, it is. It
so
depends.
They need those blood vessels.
They need those blood vessels. And then the problem is it can grow abnormal blood vessels, and it should stop. Now, if you don't know what angiogenesis is, maybe you understand this. You see how fast a baby grows?
Yes.
You know, I have a son now. He's about 6'3" now. When he was born, I was afraid to hold him. His mother,
tiny.
Yeah, his mother put him on a pillow because I thought I'd crush him. So I would hold him on a pillow. Now he can hold me on a pillow.
He's a giant.
You see what I mean? Children go through growth spurts. That's angiogenesis. That's the normal angiogenesis. Little girls and boys, they got red cheeks and their skin look healthy. Their eyes look bright. That's healthy angiogenesis. As you grow older, cheeks get dark, and you got to put some paint on it to make it look red. But I'm saying, you see how healthy they look? Angiogenesis, healthy blood vessels. But as we get older, we develop that angiogenesis process stops unless you get cut. If you get cut, or somebody cut your finger off, take that finger, stick it back on, sew it, and guess what? It will regrow.
Wow.
It'll regrow. And so plants do that too. You can cut a plant and it will regrow. Angiogenesis process. So there is an abnormal and a normal angiogenesis process.
So what does angiogenic mean? Blood vessel formation. Tumor angiogenesis is the growth of new blood vessels that tumors need to grow.
Yes. And I'm going to just speed up. We only got very little more time left. I want to go to one area in here I want to cover. We talked about Chinese wormwood, and I won't go through this anymore. Now, it is important to know that the brain is about 85% water. So that means that with hydrogen and oxygen, anytime you got water, you got hydrogen and oxygen. So the brain needs a lot of oxygen. That's why when you overeat, you fall asleep.
So it needs a lot of water.
That's right. I'm gonna speed up now. One particular herb that we use that can cross the brain barrier is pokeroot. Pokeroot with the phenylalanine. That's an amino acid. We mix that with the pokeweed, we can cross the brain barrier. And then if there's any type of infection in the brain, then it can take care of that infection in the brain. Just gonna speed on up. I wanna cover a section because I wanna at least touch a little about what we're gonna do. We've explored a lot on this condition, but we need to talk about now, how can we cure the incurable? But this is definitely an incurable condition. This brother right here had an oral cancer of the face, which also had spread it to his brain. I'm gonna let you look at him. I worked with him. Now, we had already applied, and I'm an herbal surgeon. We had already applied a herbal salve on his face. I'm looking in his mouth in a flashlight to see if that salve had eaten all the way through his jaw, but it hadn't. It did take that tumor off the side of his face. And you can see that big open cavity on the side of his face where that tumor was lodged in his face. It has dropped out. Now, his wife collected the tumor and put it in a jar so I could see it the next day. When I got there, to my excitement, I see this big tumor in this alcohol. And so I'm gonna take it out, and I looked at it and it felt like a stone. Wow. It was hard. Yes. Now, it looks really bad. Now, he's very happy. The tumor is gone. It killed all the roots and everything. Now, he didn't have to go in a sophisticated surgery. That process of angiogenesis was a process of a salve that was made that works like angiogenesis. It went in and dried up the blood vessels, cauterized those blood vessels, caused that tumor to fall out, and which formulated into necrosis tissue. Now that's him right there. After the process was finished, he got a little scar on his face. The whole thing dropped out. It dropped out. But see, you saw back here, you've seen this. Well, I won't go back because I had to play it. But you've seen it when it was all swollen on the side of his face. And it looked horrible. But the swelling went down, left a scar on his face. He can identify with Jesus because he's going to have little scars in his hand and his feet too. Right. And he'll have it to the rest of his life. Wow. So I'm just going to go through a few more here, and then we kind of open up for some questions. This is another one here. This girl had an oral cancer spread it to the brain, one side of her brain. And I worked with her, and it's an old video. That's why it looked like that. It's almost 36, 37 years old. You can see that tumor in the upper part of the palate of her mouth. Well, it had metastasized up in her sinus and behind her eye and her whole jawbone. It had spread it to her brain. Doctors had given her 6 months to live. When I began to work with her, I had no concept of herbal surgery. That's her right there. You see that spot right on the side of her jaw right there. I applied it to salve right on the side of her jaw. It ate through her jaw and burst the tumor and drained that out of her mouth. But it had such an impact that it created what we call phagocytosis, which it boosted a tremendous amount of immune response that those white blood cells went all around her head and killed most of the cancer in her head. So even though it localized, it destroyed the tumor, the white blood cells wasn't finished. They went looking for any stray tumor cells and tissue to get out of the system. They had given her 6 months to live. This girl lived over 30 years. Now, this is the same girl. This is the same girl. 30 years ago, when I was working with her right here, that's her right there, same person. 38 years later, in 2014, she came back to me. She had continued to do some things I had wanted her not to do. The cancer had reoccurred, and that's the side of her face right there. Now look at this. That's her looking from the front view, 2014. Now she asked me to remove the tumor. I cannot remove it because it's covering a whole side of her face, her nose and part of her mouth. And if I try to remove it, swelling gonna occur, and it was strangulated. That's a side view of her right there. Can you imagine having something like that on your face? But she did, and she eventually passed away. So that kind of give you, and I have worked with so many different cases. This is one Scott Turner worked with. And over in St. Lucia, this man had a large tumor growing out the side of his face. And Scott went there and worked with him, did a tremendous job, but you can see the effects of that tumor on his face. His whole nose and everything was blocked. The little breathing he can do is through his mouth. And these are what different people had surgery on their brain. Now, garlic can cross the brain barrier. And garlic and cayenne can be mixed together with different herbs. And guess what? Even though some herbs may not can cross the brain barrier, but if you mix with garlic and DMSO and a little sugar, it can piggyback and take it across the brain barrier. That's what you call a cocktail. In other words, if I try to send the herb by itself, the brain barrier says you can't come here. But if I mix it with a little sugar, now I know y'all probably saying it, but you mix it with a little sugar, with a little garlic, and a little L-phenylalanine, amino acid, it will pick it back and take it to the brain barrier. The brain barrier will see the sugar. It recognizes that the herb is there, but it's so in desperate need for the sugar, it will take it on through. And once it gets in across the brain barrier, it can do its job. And that's the way you have to be able to work with the brain barrier, because you're not gonna get through that unless you really know how to deal with it. And as we get ready to close, some of the other things is that perms and chemicals that people put in their hair is one of the main reasons why they're having a lot of brain issues. You shouldn't do that. These chemicals are so toxic that they can burn your scalp, cause irritation, and this irritation can lay the foundation of abnormal growth. I work with some most impossible cases. This is a case I work with, most impossible. I mean, it looked like he's from another world. But when I see these cases, I said, Lord, I said, what are you doing? Give me a little arthritis, a little diabetes, a little something. That's why are you giving these to me? And he told me, he said, because you're in such a big disadvantage, you have 3 liabilities. You're Black, you're ignorant, and you're broke. He said, you're not going nowhere, son, with that but the ghetto. So I'm going to give you an advantage. He said, take on the most incurable cases in the world, and there'll be no competition for you. That has been the greatest instruction I've ever had. If I had not gotten that instruction, I don't know what would have happened. But I did exactly what he told me. Every most impossible case that I could think of, I went for it. And it made a big difference in my approach. So that's what I want to share with you. Briefly here, it'll take me a few minutes to go through this, is the treatment protocol. We give them plenty of vitamin C, about 5,000 milligrams of vitamin C 3 times a day. Don't worry about that high level of vitamin C. Vitamin C is a water soluble. All that your body don't use is going to urinate it out. We give them beta carotene. We take 100 capsules of beta carotene and we boil it in about 8 ounces of carrot juice. We make an extract out of it. We take the gelatin capsules, strain that out and throw that away and let them drink about a half an ounce of this beta carotene cocktail, a tincture, 3 times a day. We give them no enema intestinal bowel cleanser. That's just a bowel cleanser we give them because we want to relieve the body of the toxicity. At the same time, we want to build the body up. We give them 500 milligrams of L-lysine. We know lysine is really good for herpes, for viral infection, so we incorporate that. We remove all fried food, denatured, devitamized foods from the diet. We put them on an 85 to 100% raw vegan diet. We give them plenty of juices. We give them 2 tablespoons of flaxseed oil or linseed oil. They drink at least 8 ounces of water a day. We also give them a protein drink so they won't lose so much weight during this detox process. We give them hot baths, such as steam baths and fever baths, hot poultices. We make sure we check them, make sure they're not too dizzy. Sometimes when you're working with problems in the brain, you can't give hot baths because they'll faint on you. So you got to know your patient. You got to know the problems he's dealing with. We give them coffee enemas because coffee enemas expel the bile, the B-I-L-E, out the gallbladder, and the surplus amounts of bile is what kill their appetite, make their pain worse. Do you know that when we work with patients that are in a lot of pain, sometimes we give them 5 or 6 coffee enemas a day to wean them off of their pain medicine. It's the bile, the B-I-L-E, that get in the bloodstream that overexcite the nerves to make the pain worse. Reduce the bile. You know what the bile is? Yellow jaundice. Yellow jaundice is what it is. So that's what we do. We give them a herbal formula called herbal chemo. And these herbs are there to help fortify the body's immune system. One particular herb I really like is periwinkle. Sometimes we use as much as 1 pound of periwinkle and make a tea or an extract out of it. Probably one of the best treatments in the world is astragalus treatment. I'm gonna let you bring this out here.
A group of 60 cancer patients recovered their health by taking asparagus a certain way. They dumped a can of asparagus into a blender, blended it for a few minutes, and stored it in a glass jar in the refrigerator. 4 tablespoons of the mix was taken in the morning and 4 tablespoons taken in the evening. Patients usually begin to feel better in 2 to 4 weeks. All kinds of cancer responded, except in those patients who had mustard gas chemotherapy. It is important to take the asparagus regularly for at least 6 months to a year.
I love this treatment. I love it. I mean, and people always tell me this, well, why are you giving them cooked canned asparagus? They said, that can't be healthy. I'm not giving them an asparagus for the nutrition. I'm giving them for the properties. There are enzyme properties in the asparagus that when you cook it, you increase the effectiveness of it. So you either cook it or you can use canned asparagus. And that increases those enzymes in it to be able to function against those cancer cells. This is a proven treatment. Eat some asparagus every day. If you miss a day, then make up for it. You got 21 days to do it. Every 21 days, you eat it, you break, take your break, come back another 21 days. Do that from 6 months to 1 year. And if, like I said, you've got to consistently eat it for 21 days. Okay. If you miss a day, you're going to make it up. And this treatment I have found to be really, really good. This is another one here. Share with this one also.
So this is a tofu plaster. You apply first 1/3 ounce of frankincense, 100% pure essential oil, then rub your hair with a mixture of 2 ounces of DMSO and 2 ounces of olive oil. Wait for 10 minutes before applying the tofu plaster.
I love this treatment here. I really do. This is a dynamic treatment. This treatment is not only good for brain tumor, brain swelling, it is good for any type of trauma to the head, severe migraine, anything, any congestion to the brain. I love it. I highly endorsed it. And I believe if people would learn how to do it, it's good for what?
Good for head wounds, concussion, headache, and earache. Because it is very cooling, it should only be applied to the head and the neck areas and left on until the fever drops or the ache goes away. 100% effectiveness with cerebral hemorrhage with Tofu Plaster if applied within 48 hours of the. I wish I had known that when I had my car accident. That would have been very.
I had my uncle. He had cerebral hemorrhaging, and he was in the hospital. And so they had him in the room, private room. And I told my aunt and my uncles now, I told them what to do. I said, take your little bottle of DMSO in there, and they had some ice in the ice bucket in there. I said, put an ice pack on his head, rub his head with some olive oil. And when the nurse came in there, she said, what you doing? She said, we're anointing him. They rubbed his head with some olive oil, put the ice pack on his head, and it dropped the pressure and it stopped his brain from hemorrhaging. I've done it many a times, especially if you can give an enema right behind that will lower the pressure. So I wish I had more time. I mean, there's so much more I would like to talk about. And I recognize that some of the things that I'm talking about is a little more aggressive. But I tell people, I'm not an ordinary medical missionary. I'm not. And it's simply, you know, I endorse every form of medical missionary work. But I know that the approach of the lifestyle approach is wonderful. I love it. But God called me to deal with emergency type situations. And so I believe if Jesus Christ was here today, I don't think you'd have to go to the ER. I think he is a walking, living ER. And I want to be like that. I want to be like Christ, okay? So, but I'm not asking everybody to do this. It is dangerous, especially in the learning curve. It's risky, but at the same token, it's probably the most effective way to gain your health with people that are seriously ill. So if you need any help, you know, we'll try our best to help you as much as we can. We got competent people here that can do it. Now, the day is a super busy day for me, Sister Tess. I have 4 programs to do today.
Wow.
So in 3 minutes, I have to go to another program.
Okay.
So I'm going to ask Sister Tanya, Sister Yvette, ask you two to come up, and y'all going to take over for me because I have to go and do another program. And I don't know how I'm going to do that. I really don't, because you all need to use my computer, and I got to go find another computer to go on a different Zoom in 3 minutes. Well, yeah, you can go ahead and hook it up in the Zoom. Yeah, hook yours up. I'll talk to you. You have it here?
It's in my car.
Okay, let's get it quickly.
Okay.
Yvette, will you be able to help out, or you got to go somewhere?
No, I just have to get.
Okay, so I'm hoping I can get some help. I know Sister Tanya is ready. Just, they're gonna answer questions, that's all. You can just bounce off the questions. I wish I could be here to help you with it, but I got to go because these people are waiting on me. And it's a lot of them waiting. I got over 500-800 people waiting on me to talk again. Okay, we're gonna turn it back over to the host to take over. I'm gonna stop my sharing. And once again, thank you all so much.
Thank you so much, Brother Mayman. That has been such a wealth of information there. I'm conscious that whilst you were going through, it was very quiet. Initially, there was hardly anybody putting any messages in the chat because the science that you shared with us with the anatomy and the physiology, it led me to exclaim nothing more than we are fearfully and wonderfully made. Okay, and I just said hallelujah to that. So thank you so much. The questions are flying in thick and fast. Just so that we are on the same page. We will be taking questions. I said this at the beginning, but I'm aware many of you joined us later. We're taking questions in the chat, both on YouTube and on Zoom. And we won't be unmuting the devices, only those who will be audience and those who will be from True Temple International, those who will be taking the messages from the chat. Otherwise, there'll be too many people trying to unmute at the same time. I hope that makes it clear. and I'm not going to take up too much time explaining this because I think it's clear enough. Okay, so thank you so much, Brother Mayman. And sister, sorry, what's your name? I didn't quite catch your name.
The test.
Sister Tess.
Mr. Tess, thank you so much. We will be in touch with you. So if anybody's leaving now, just to let you know, we have another presentation next week with Brother Mayman, and we're doing these every week. We've been doing it since lockdown last year. So go back on our YouTube channel. You can watch what you've missed. And we have the website as well. I can't really ask you to give us any more closing comments, Brother Mayman, because I appreciate you're wanted everywhere. So, our team, we do have some questions, but I could ask the first one if that's okay, if you permit me to ask that. Now, Brother Mayman was telling us about green tea. Or teas that we can take, herbal teas. So someone put in the chat, is green tea good for the prevention of cancer? And I'm not sure when they ask that, if they're actually referring to the green tea that you can buy in the shops, which is green tea, sold as green tea, but it does have caffeine, or if they're actually referring to the herbs, as in going and picking nettles, burdock, some other green leaves, and using that to make a tea. But I'll throw that one out to the to the team. Is green tea good for the prevention of cancer? Sister Tess?
Yes, you said, was that green tea good for cancer?
Yeah.
It is.
That was a question.
Green tea is actually a part of the herbs that produce anti-angiogenesis effect. It also boosts your immune system. So it is very good for cancer. One of the better ones.
Got it. And by green tea, I'm sure they're not referring to the green tea that you can buy in the shops, or can you get green tea from the shops that's non-caffeinated?
Well, as long as it's non-caffeinated, I mean, as long as it's good, organically grown green tea, it should be fine. Yeah.
And of course, people can make their own. Whoa, we're glad you're still with us, Brother Mayman. Hey, we have extra grace.
Okay,
okay.
I'm going now. I'm going to turn it over to my son, Zebulon, and Tanya, and Jay. They all are here, and they are well capable. I know, Jay, you can help out too, can't you, Jay? Okay, but Jay and Zebulon and Tanya and Yvette, they should be able to answer those questions. Thank y'all so much. I'm late. I got to run.
Brilliant. Thank you for extending your time with us. We really appreciate that. Lovely. Okay, so I'm going to ask, I know we've had some questions, quite a few questions in the chat, but Janine, we'll take the first one if you have any questions. And yes, we see hands, but please write your questions in, and then the rest of the admin team will pick it up. Janine, you have a question for us?
Yeah, so someone's asking about the tofu plaster. I think there was a method on how to make that. So someone's asking, how do you make the tofu plaster?
Hi, I'm Janine. I can sense there's a quietness on the line. Or our panel ready?
Sorry, I thought I lost sound.
No. Centurion, are you there?
We're going to need to allow Tess's laptop to unmute, if that's Can we find Tess's laptop? Sorry about this little hiccup. Tess, is your laptop available? Sorry. Yeah, Tess, is your laptop available now?
Hello, can you hear us?
Yeah, we can hear you.
Okay. All right, what was your question again?
How to make, Janine, can you phrase it?
Yeah, I think it was how to make the tofu plaster. I think during the presentation, there were some directions on how to make that. So someone's just asking for that information again.
Tell them if they could just send that question in via the chat, and then that way someone can email that to them. Because there are some questions, the protocol that goes along with that.
Okay, so you said to email the Centurion.
Just email, Jay will put the correct email address in the chat.
Okay.
I'll have Jay to put it in the chat.
Thank you very much. Also, if Centurion are doing a course currently, we're happy for you to promote that. If you do have a flyer on your laptop, on your device, we're happy for you to share that with the audience here. Okay, there's another question that came through, mobile phones. Okay, unless you have another, do you have another question, Janine?
There are more questions, but go ahead.
Okay, this one just said mobile phones. Is this a hindrance to the brain due to the radiation?
I'm sure it is. I mean, I don't know of any studies, that have been done on it, but I'm sure, over a long period of time, over a prolonged period of time, I'm sure there are some dangers to that because of the radiation and it's being, exposed to your brain. I'm sure there are, but again, I don't know of any studies on it.
Thank you. Could you, when you're speaking, could you put your camera on, Tess? Because we can't see you. Okay, Janine?
Yeah, so someone's asking.
Jay's working on that right as we speak.
Okay, brilliant. Okay, thank you. Thanks for your answer as well.
So we have another question around natural hair dye and whether this can cause or contribute to cancer of the brain.
Again, by it being natural, and now I don't know a lot about hair dyes, and so I don't know exactly what's in it, but again, if it is natural, and once again, a prolonged period of time, a study that has been done on it, if it's natural, I know a lot of people do use natural hair dyes, but I don't know a lot about that, so I don't know if it's linked to cancer or not, because again, I don't know exactly what's in it, and I haven't researched it.
Yeah, you want to make sure it doesn't have any chemicals in it, and if it does have chemicals, it's definitely going to affect the brain. Can you hear us?
Yes, yes. Okay, just going back to a previous question that I asked about green tea. Someone on YouTube is asking, does it have caffeine? Now, obviously the green tea that you can purchase over the counter, many of them do have caffeine, but if you can get one without caffeine, then that's going to be good for you. And also, if you are going to make your own using the herbs that you can get through foraging or from your own land, your garden, your so long as there's no animal waste on it, you're going to wash it good and make your teas from that. Okay, Janine, any more questions?
Yeah, so we've got one about what is good for memory loss.
For what
memory loss?
You can take some ginkgo. You can take some gotu kola. Yeah.
Coconut oil.
Thank you.
Coconut
Coconut oil is
oil.
an excellent one.
Yeah.
That's a very, very good one. Coconut oil is
Taking
very
a
good.
tablespoon of coconut oil every morning on empty stomach is very, very good to prevent Alzheimer's as well. And also ginseng.
Ginseng. Also, how old is the person who has the memory loss?
How old is the person with memory loss?
I'm not sure. This question came through quite before Brother Mayman had left the sofa. The question came through, but does it depend? You know, does the response depend on the age of the person? And if so, what ages are we, you know, specifying the coconut oil for? This is a question to the team.
The reason I ask, take for instance, if the person is a woman that's going through menopause, and that is one of the symptoms of her menopausal period, then you would have to treat the other causes to get rid of that, because you have memory loss, brain fog, because your body is no longer producing the amount of estrogen that really affects the brain and how the brain works. Then you will understand that if you treat the other symptoms, then you will get rid of the memory loss.
Yeah, that's a good point Sister Yvette just raised. Always ascertain the cause, because what if a person's not sleeping at night? What if they're working at night, or they're putting something into their bodies that is causing the symptoms? Then it is always important to ascertain the cause and correct the wrong habit, and then turn to herbs, and the Lord will bless.
And another thing that can cause the memory loss is you have to be careful what pots and pans you cook
The
in.
aluminum,
That's
yes.
very important.
Yes.
And believe it or not, if you read the book Healthful Living by Sister White, you will find a very weird cause, I would say, of memory loss is overeating. Because anything the body does not see as any excess we put in the body sees it as poison. So every day we overeat, the body is fighting poisons. And then that goes into the blood and it is circulated to the brain. So it makes the brain malfunction. So like Tess said, you have to ascertain, because there's so many other reasons. There's one person, there's a lady on YouTube, I'm just not remembering her name right now, who, no, she was a cop, but no, she's a naturopathic doctor. And when she started her work as a cop, they would always give the cops, you know, the jobs that nobody wants to do. And she was given the job as a rookie cop to guard the morgue, to work at the morgue. So she was working at the morgue and she got bored, and the examiner said to her, why don't you, instead of just sitting there bored, try to decide based on the bodies what each person died of or from. So she saw the body and she saw the head, the scalp came off, and the brain of certain women body, the brain was black. And she said, oh, that one died from a brain trauma. And she saw a number of the brains like that, and she said, wow, a lot of them died from brain trauma. So the examiner told her, no, they didn't die for it. And he said, I'm going to show you. So the examiner went and he cut off the cup here of the brain or whatever, of the head and the skull, and then of a woman that had natural hair. Nothing was done to her hair. And he told her that those with the brain that was black are the black women who usually put the hair chemical, the perm, in their hair. So it was damaging their brain. But imperceptibly, they did not know, because it's over time that these things stay to happen. And this is the same way with the brain. Sister White says in one of her health books, you can look it up, she said, numbing of the brain takes years. So you have to start treating your brain good now so that it will treat you good later. And so I have so many other reasons I could give you, but I'm going to stop here as to why you could be having the memory loss.
Thank you so much. I think that covered the question. The individual was a 58-year-old woman who was experiencing menopause for many years. And I think that's what you kind of focused around, that age group, and focused mainly on women. And that's who the question was directed from. So
a good thing for her would try to see what she could do to bring up her estrogen level, and see how she can balance the rest of her hormones to help her with that. But like the panel said, there are other herbs you could do. And she should try to make sure she's sleeping, because once she starts not sleeping, then some of the hormones in the brain is not going to be produced, so the brain is not going to operate as usual. She needs to exercise so that her BDNF factor can come into it. A lot of hormones she's going to need. Exercise is very important for her.
Excellent. So sounds like you're talking about New Start. For those of you who are unaware of New Start, they're the 8 health doctors that we should be searching to implement into our lifestyles. If you write down New Start down on the piece of paper, and it's an acronym for nutrition, exercise, water, temperance, air, rest, and trusting sunshine. Did I say that one? You know how to spell better than I do right now. And trusting God. Those 8 doctors will help you along with everything else, the other advice that we're giving. One of the questions came through on YouTube, and you just dealt with it ahead of the question, and it was, is peroxide in dye bad for your brain? So I believe you've covered that one with hair products. Okay, Charlene, do you have any questions that we haven't addressed yet?
Hi, Sharon. Hi, everyone. Well, one person is asking, what is DMSO? I can't remember the name of it, but someone's asking that question regarding DMSO, and also mushrooms, aren't they a fungus as well?
DMSO is a solvent. I can't remember the full name of it. You have to look it up online. It's dimethyl something. But it's basically a solvent that's made from the pine trees, and it just helps to penetrate whatever you put it on. Like if you use olive oil or cayenne pepper or whatever, it's going to help to penetrate that deeper into your skin. So we use it a lot when it comes to pain medications, because it helps people that have to reduce the amount of pain that they have in their body. Whatever kind of pain formula that you mix, you put DMSO on top of that, and it will help it to penetrate into the skin. But you do have to be careful with it. Make sure your hands are clean, because if your hands are dirty or if you've got something on your skin, it's gonna take it into your skin. So you have to be careful when you do use it.
And the person to DMSO that we, at least in the islands, they used to use is turpentine. So it's from the same family group, and they also use it. Yeah, I know it's for painting, but it's also very, very good. And Sister White said in one of her books, I can't quote, I don't have the reference right now, that she saw that there is medicine in the wood. So these in the pine trees. So these are some of the products that we get from them.
Thank you. Okay, Janine, Ben, I've seen your hand, but we are taking questions in the chat rather than allowing people to just keep unmuting. Okay, and I did see that someone put in the chat the response to what does DMSO stand for. It is, if I read it correctly, dimethyl sulfoxide or dimethyl sulfoxide. Okay. Janine, do we have another question?
We do, and it's in line with what's been spoken about already. So someone's asking if there can be a little bit more information about cancer precursors, specifically around anything else that you could be using on your head that could potentially penetrate the brain.
They want to know, like, if they're eating good natural hair dyes.
You know, there is something that you can use. It. Yes, that's what somebody told. But you know, if you just want something to color your hair and you don't want it to look badly, It's not anything permanent, but you could just get some charcoal, mix it in some castor oil or olive oil, and just take a little toothbrush or your brush and brush it in your hair, and it's black for the day. You just tie something on your head in the night so it doesn't get on your pillow, and there you have a dye. Your hair will be as black as jet.
And case in point, I have charcoal. I have that very recipe in my hair right now. So my hair is very black today. But also, Mayman in his book, God's Medical Kit, he has some recipes for natural hair dyes. So you want to check those out.
Also, one of the things that you could do that we do, and sometimes you're not conscious of it, and this is I believe the research behind it is, you know how we never go anywhere without our cell phone, right? If you forget it, you go back for it. When we sleep in the night, we shouldn't sleep with our cell phone inside. Before the research was done, when they just started bringing in the cell phone, I even this minute I can do it. I can take up my cell phone and just put it to my ears, and instantly I get a headache. Instantly. I have a friend who, she's a twin, and she was always talking to her twin sister on her phone, but she uses her left ear. And sure enough, after a while, her left ear was so blackened just from her using the phone so constantly. Her ear looked like a lady who had done radiation for cancer, and it had blackened her extremities. That's how my friend's ear looked after a while. So we can use things like these that we don't suspect, because let's face it, nobody has a cell phone 100 years or so. We have not been using it long enough to know the long-term effects that it has on our bodies. And all of us have electromagnetic field around our bodies that from the cell phone interrupts it. So we have electricity in our bodies. So we want to make sure that we're not using things like our cell phone to do that. There is a story that I've told when I did a presentation with another class about destroying the frontal lobe of our brain. And there was a man who, his name was Phineas Gage. And Phineas Gage was a good moral man with good standing, had one wife, and so on. And one day he went to work. He was responsible for blowing up the mountains so they could make the railroad through the mountains. So one day he came to work, and somebody forgot to load the area with sand. So when he came to detonate the bomb, it was iron touching iron. And he had a 3 feet iron pole that he was to use. And when he went there to knock the iron, because there was nothing between the two iron, it exploded. And instead of going through the mountain, it went through his chin and exited through, went through his chin, took out to his eye, and came out in his brain. And it took off a piece of his frontal lobe. Now, believe it or not, he didn't die. At least not then. He actually was taken to about 2 miles, they said they had to walk. He was taken to the doctor, and he spoke to the doctor. Wasn't crying, wasn't in pain. He spoke to the doctor. And of course, after a while, he got infected, but they helped him through the infection and he was fine. And nothing, terrible happened, except they noticed that he was an entirely different person. He now swears. He was lazy, didn't want to work. He was not interested at all in anything about God. He left his wife and he joined a circus. The last they heard of him, he was in the circus until eventually he died. And that sparked the first investigation into the effect of the frontal lobe and our behavior. But we today, we don't destroy our frontal lobe by, pinching off a piece. And that's what lobotomy was, a surgery that pinched off a piece. When people were not behaving right, they would pinch a piece of the brain off, but then they realized that the people would behave like dummies. But now what we do is that we do the same damage to our brain through the music we listen to, the TV shows that we watch, and even the food that we eat, the video games that we stay hours playing, these will damage the brain. And finally, the servant of the Lord said that the understanding adapts itself to the dimension of which it has to deal. What she said is that if we only think of earthly things and never anything heavenly, our brain will shrink and it will lose its ability and its capacity to hold information. There goes your Alzheimer's. Okay, so if we want to preserve our brain, we've got to literally compare what we do to the laws that God made, because He has made our body wonderfully. And if we counsel with Him, we're able to make decisions. Because sometimes things that doesn't seem wrong to someone else could be wrong for you, because God and you had that talk and He told you about it. So take our problems to God and He will show us what to do.
Okay, thank you so much. We have had quite a lot of information on the brain cancer and the issues, but just reminding you, we've also been looking at cancer of the gut as well. And one of the things that Brother Mayman spoke about, oh, Edgar's just taking my notes. One of the things he just spoke about was improper elimination and digestion of food. So we need to be mindful about how much we eat, how often we eat, and what we combine with our foods, because that is also going to create a problem in the other brain, the gut. Now, I'm aware somebody did ask about which books is available that Brother Mayman has. I've got one here. Don't know if you can see very well. This one's called Back to Adam. And it's actually in this book that I've looked through to find a challenge for you for this week, this coming week. So the challenge for everybody this week is, so long as you don't have difficulty eating, oh, he's taking my notes, here we go. Difficulty with wheat bran, it's to add 2 to 3 tablespoons of wheat bran to your food each day. So that's not a hard one. I've written other ones down, but you might not want to do those. Okay, but yeah, that's 2 to 3 tablespoons of wheat bran to your food each day. That's going to help, obviously, with the fiber. Okay, so someone has put in the chat the names of the other books. If I just quickly look through, we have, here we go. Back to Adam, God's Medical Kit, and the Cancer Book. I'm not sure if it's actually called the Cancer Book, but maybe the ladies and
it's on cancer. The topic is cancer. It has to do with all different types of cancers and their protocols.
Okay, right. So can they get that if somebody was to look for it on Amazon? Could they get access to the book?
No, you'd have to call the office, and we can put that number up on the chat.
Okay, so here's what one of them looks like. That one's Back to Adam. Okay, do we have any further questions? That I know things have been flashing up on the chat. So Janine.
We do have another question, but before I go there, there are some questions of a personal nature in the chat. We won't be asking those because they may need a consultation. So we just advise those who have any personal situations to contact Centurion directly, and the email address has been put in the chat. But there is a general question about the liver cancer protocol that was talked about by Brother Mayman in a presentation. And someone's asking, can that protocol still be used as a liver detox, even if the person doesn't have liver cancer?
I didn't see the presentation, so I'm sorry about that. So I'm not sure. But again, if they want to send that information in, if they want to ask that question, they can email me, and then I can take a look at it and I can see, because I wasn't here, so I missed that part. I'm sorry.
Mm-hmm. Okay. We have got information in the chat. If this can be relayed, in fact, I'll speak it, because obviously those on YouTube aren't able to see the chat. So it says the books are, the cancer one is just called Cancer, and you can get all 3 books from the office. I will read the number, so you'll have to rewind the tape a bit or the video. And this is obviously in America. It's 931, so you'll do +1 if you're calling from abroad. 931 724 4855. I'll repeat that. That's +1 931 7244 855. And they've added Tennessee time, so I guess they don't want you calling them in the middle of the night for their American time. Okay, thank you. Do we have any further questions that are of a general nature? And the reason why we're going for general questions is because we are live on YouTube. We don't want anybody disclosing there. It's for your protection as well as us not focusing on one individual case, because I'm sure one individual personal consultation could take an hour or longer. So that's why. So do we have any more questions? I know another one just flashed up, but I can't remember what it said. Something about pomegranate.
Yeah, so I think one of our viewers made a recommendation in the chat around pomegranate and juicing beetroot, and someone's asking how you do that. So I don't know whoever it was that posted that information, if they could respond to that question. Or Centurion's actually answered, so yeah, the answer's there. I myself can't see any other general questions in the chat, Sharon. I think the rest of them are more consultation-based questions.
Okay, Okay, something about perfume and aftershave, and then I've got another one that's come on YouTube. Okay, so I'll go back to the YouTube one because this person maybe have been waiting for a longer time. Is it safe to use earplugs? This person, Spencer Faith, I believe their name is. Is it safe to use earplugs? Now, from that, I think they mean headsets with your mobile phone. I think that's what they mean.
You mean like headsets that's attached to your phone?
Yeah, you know, like I've not got one near me, but you know, the ones that's attached to your phone, you can just, as opposed to putting the phone directly by the side of your head.
Oh, I mean, radiation can get to your head from that too. I mean, so, I mean, again, but there's no studies that we have to show the effects of that and how long that takes to affect you. But I'm sure that there are effects that there are some, you know, dangers to that as well.
And I noticed a lot of
one of the things you probably want to be mindful of is moderation. If you have to use them, don't use them too long. Right. And when you're listening, you know, I see what we do nowadays. Whenever we have our things plugged in our ears, the music in there is so high you cannot hear someone is talking to you on the outside. What you're doing is climatizing your ears to that sort of audio or that level of audio. So you don't want to do that and train your ear wrong. You want to keep them at a low volume so that you can still participate in the world around you, one. And then you want to not use them so very often, you know, because everything needs air, even our ear.
Yeah, that is so true. Nowadays, mobile phones have such good speakers that you can put things on loudspeaker. I mean, I'm using this I'm broadcasting from my phone at the moment, but hey, it's hands-free. There's nothing, no strings attached. Okay. Another question was with regards to Bluetooth as well, but I think, well, I'm just going by what I think. That's not good enough. So the question is, are Bluetooth headsets dangerous to use, or are they okay?
Again, you know, I go back to the same thing. I don't have the research on the Bluetooth because I don't know exactly, you know, the level of whatever may be in it, radiation or wherever it is. But just like Sister Yvette said, you got to do everything in moderation. And that's just not with, you know, the cell phones or what you eat, it's whatever you do. Everything needs to be done in moderation. So you just have to kind of, you know, when I say this, please don't take this the wrong way, but God gave us some good common sense to use, you know, and so we have to do that. We have to stop and we have to think and we have to pray. And we just can't use anything excessively.
Okay, thank you. Thank you for your we might be just taking this last one. Somebody said, is perfume and aftershave good to use on the skin? This was an individual's question. Is perfume...
It's going to depend on your skin. It's going to depend on what is in the perfume, what is in the aftershave. So you have to look at each case individually, to see what it is and what you're using. And if you're not sure, research it. Some things, it's just like I tell people when they go to the grocery store sometimes, if you see something that has this long name in it, it's probably not good in the ingredient list. But research it. One thing that we do have is, I believe that God has given us to use for good is the internet. You can research things on the internet. And you can find out if something is good or bad for you. Sometimes you have to test things on your skin, to see whether or not it works with you. Some things don't work with one person's skin, but it may work with someone else's. So it's just a lot of factors that are involved. It just depends on the individual person.
I have a philosophy that I heard someone with it, and I liked it, and I took it up. It says, anything I use on my body, I should be able to use in my body. Right. Okay, so a lot of times to shave, you could actually use the gel of the aloe vera. That would give you a good shave. You could coconut oil can be used as in your creams or whatever you make for your body. We're learning to make our own soaps, conditions, deodorant, lotions, creams. Well, I don't know much about shaving, but I know people.
Yeah, there is a shave.
There are some good soaps you can use.
And in the book too.
I want to say, I'll give kudos to the book as well, because God's Medical Kit has several natural remedies for perfumes, for shaving, and for lotions and soaps, all natural. And you want to stay the least amount of ingredients in your products, the better. You want to stay as natural as you can. Stay away from the preservatives and all the chemicals. The less of that you participate in, the better for your health.
Let me say something. If we find we should be able to take our showers, and that should be enough. Now, I'm not saying that that's the case, but we should be able to do that. If scents are coming out of our bodies that is obnoxious, then we have to ascertain why. Why am I smelling? Why my arms smell this way? And then you start to look and clean the inside. So whatever comes out is going to be a reflection of what you put in. No, nothing that comes out of our bodies, we should be running away from. You should be able to go in the bathroom with someone using the bathroom and don't know that they're using the bathroom to do number two. You understand? Because of what we put in, that's why we get what we get,
It goes back to our diet, like Yvette said. On a plant-based diet, there should not be any foul smells, whether it's under our arms or whether it's in our bowel movements. It should all be fragrant. It should not have any foul scent whatsoever. So there's basically not a need for perfumes, but there are some people that do love to smell. They love to smell something fragrant. And that's
essential oil,
and that's okay.
Like lavender or something like that. A nice essential oil is nice. But again, if your skin, can't take lavender, then don't use it. So again, I go back to the individual person. You have to look at yourself and see what you're allergic to or what your skin may not be able to take. But again, that could go back to what Sister Yvette said. You may just need a total detox. You may just need to detox your system.
And believe it or not, we should try to live in light of Revelation 13:70, the time when we cannot buy ourselves. Think about it. If we learn to make our own products and we clean ourselves, there will be less need for us to run into the store to get some of these things that we will not be able to get in that time. So we don't want a bunch of people running around, not smelling good and saying that we're medical missionaries and stuff. So we want to train and prepare our bodies for that time. Anything, begin now. Small changes that we need to make, and then we will see a big difference. God will be behind his truth.
Yeah, the time to be self-sufficient is now.
Okay, so that was a lot of information there. And one of the things you also said about when you what you put inside is important. It's also about the combination of foods, because obviously if you're combining your foods incorrectly and it's fermenting inside, that's going to be recognized when you go to the toilet or if you pass wind. The aromas that come off might not be essential, sweet smelling, put it that way. Well, it might be sweet, but hey, not very pleasant. Okay, and thank you for mentioning the essential oils, because we do have an essential oils class on a Thursday. That's Thursday, 7 p.m. UK time, on with True Temperance International. And we're learning a lot about the body systems and how essential oils can be used to help with enhancing our health, boosting our hormones, our emotions, and also for the perfume effect. But so you have the aromatherapy and what it does to the mind, crossing the going to the brain and getting into the cells, but also the beauty of the smells as well, and they're natural. I think we may be out of time unless there's maybe room space for maybe one or two more questions. A lot of questions have come up on the chat, and the information is going on there as we speak with regards to where can I get hold of the books. Obviously, if you're on YouTube, you can just rewind the video because the information is there. I'm not sure if I've missed anything else, but do we have any more questions, Janine or Charlene? Or Edgar?
Not from me. Okay, no, Sharon, not from me.
Yeah, not from me, Sharon.
Okay, that's all then. So just okay, so Edgar's just going to display the. Oh, okay. Can somebody make Edgar a co-host on our lap, not the old laptop, but the device that he was using, so that he can screen share the Telegram groups, just so that those that are on YouTube can see that before we come off, and also the YouTube, well, the donations page. If anybody wishes and feels moved to donate, we have a page there. But if you go onto our website, truetemperanceinternational.com or .org, you'll be able, you can use either one, you'll be able to access our web page, and there's more information on there. Okay, so there's a screen. You may have to turn your device widthways so that it's a bit big. Oh, thank you. Okay. So there's the 3 Telegram groups that we have currently, where we are encouraging each other, sharing recipes, sharing tips and encouragement throughout the week. So we have the Women's Wellness Group, the Men's Wellness Group, and the Spiritual Health Group. Okay, we're conscious that people coming on these platforms from various backgrounds, and so we have categorized the groups so that if you want to hear more devotions, you may go join the Spiritual Health Group. If you want to see about recipes, the men's might do it, but I know the women's do, but we're only having women on the women's group. But the men's group also, they tend to have discussions on there. And Edgar, if you'd like to switch to the other one you did have, there we go. So that's if you feel impressed and are blessed to giving a contribution to the work True Temperance International is doing, please donate to our PayPal account, and the information's on there. Okay, so currently we are working on our website development. We do have a homeless feeding project that we support every week, and we are also handing out literature, and occasionally free gifts come out to you. So they're not free to everybody. Some people have. So next week, we are going to have another presentation. Thank you so much, sisters. And the Zebulun popped in and popped out again. There may have been somebody else. Thank you all so much, our guests. Can you just tell us your names again, sisters? I know one's Tessa. Pardon?
I'm Tanya.
Tanya, if you can look towards, I'm not sure, Tanya, you look towards your right because we can't see you. The camera's this way.
I'm waving.
Oh, there we go. Right. So Tanya is waving.
Yvette.
Hi, Yvette. Thank you.
And I'm Tess.
Thank you very much, Tess. And thank you to your team. We know this can't be done without the PA team. So the guys that are working on that, or females, whoever you are, we thank you so much. The audio visuals, well done, well done. Okay, so I thank God for, thank you for your presentation this afternoon. Feeling blessed with the knowledge. Thank you very much, Veronica, and everybody else. We thank you for joining us. So next week, we will have another presentation. I'm just going to see if Edgar can give me the topic. Okay, we may be continuing with cancer, but stay tuned to the post, to the groups. We will keep you posted as to what will be the topic, but you won't be disappointed either way. If it's not you directly involved, I'm sure you know somebody that you would be able to share the information with, and they will be blessed by what they hear and the information they learn. So unless we have anything, I don't think we have anything else to share with you. So thank you once again for joining us on the TTI Family Health Show. We look forward to seeing you again. And it's at this point that I'm going to say, oh, the challenge. I'm going to repeat the challenge. So the challenge for this week is to add 2 to 3 tablespoons of wheat bran to your food each day. That will help with your digestion. And also continue with the challenge that we set last week, which was to identify in your surroundings as you go out. Spell it. Okay, I'm not sure. Wheat bran, WHEATBRAN, wheat bran. But if you go around and you're surrounded, see if you can identify whether you have an app on your phone or whatever device, or just look it up and hope that you get the right thing. Nettle, cleavers, burdock, and dandelion. And there was some discussion about dandelion root, extracting that. Best thing, dig it up fresh, provided you've not had pets urinating in that area. Dig up some of that and utilize the blessings of dandelion root and the flowers and the leaves. You can even add the leaves to your salad. Thank you, those of you who are adding that. So you can take a photo of yourself. Obviously, if you're picking the nettles, you're going to have to wear some protection on your hands because they will sting. But then if you're going to cook with it, we can talk to you about that on another occasion. I can keep talking forever. So I think it's time for me now to be quiet and say goodbye to all our listeners on YouTube. If you wish to stay on, those who are on Zoom, you can stay on and you can unmute. And we've taken all our questions now. So if you just wish to unmute and just let us